Good evening and welcome to another informative episode of the Skin Therapy Show. I am your host, Sarah Ndanu. As always, we bring for you experts in skincare who are ready to talk everything skin. Today we are at the luxurious Revitalize Wellness Center. So come with me and let's see what we have in store for you. Joining me on set today is Dr. Pancholi. Welcome on set.
Thank you.
For those who don't know you back at home, tell us a little bit about yourself, what you do, and how long you've been doing this.
Okay. I studied dermatology at Harvard Medical School 8 years ago and then came back to Kenya, and now I practice dermatology and cosmetic medicine and cosmetic laser surgery at Yaya Center in Nairobi.
You've spoken about laser surgery. Please expound on that and what is that all about?
We have a lot of different lasers that we use to treat different conditions in the skin. A very common treatment that everybody is now getting is laser hair removal. Yeah? So for ladies who have hormonal imbalances, and sometimes the hormonal imbalances give rise to a few hairs and a mustache and things like that. So for that, we do laser hair removal. If you're going to the coast over Christmas and you want to get your bikini line waxed, now instead you can have it lasered because laser is permanent. Yeah.
All right.
Yeah.
So wait, what you're trying to say is that when I have laser hair removal, I will never have hair in that particular area?
Absolutely. You need between 6 to 10 sessions to complete the treatment.
Okay.
And the laser that we have is actually safe on dark skin. And that's a very important question you need to ask before doing a laser treatment. But after 6 to 10 sessions, the hair doesn't grow. So even if it's the underarms, because you know, ladies, when they want to wear something short, the first thing they do is, I have to wax or I have to shave. Yeah. But now with laser hair removal, which is permanent, you don't have to think about that anymore.
Wow, that's amazing. I shall try that. Now, apart from laser hair removal, what other laser surgeries do you have? Do you offer?
We offer laser treatment for dark spots, laser treatment for melasma. We do laser treatment for leg veins. We do laser...
Stretch marks?
Yes, we have a laser treatment for stretch marks as well. And everybody gets very interested as soon as I mention laser treatment for stretch marks, because most women from the age of 18 onwards do have stretch marks.
Yes.
And what happens is with laser treatment, we are able to reduce the visibility of the stretch marks by 60 to 90%. Stretch marks once formed don't go away completely. And we are able to make a difference, but the expectations have to be realistic. But we have had some amazing results when it comes to laser treatment with stretch marks.
What are the common facial problems that you've handled?
Acne is one of the most common problems that we get. Teenagers are prone to acne. However, we have adult acne as well. And as I'm sure you're aware, even contraception can bring about hormonal imbalances.
I've actually dealt with that before.
Yes, yes, absolutely.
Yes.
So when contraception starts causing an imbalance between our estrogen and our testosterone, and we actually, it's like a seesaw, yeah? Both men and women have estrogen and testosterone. And sometimes, for whatever reason, if the contraceptive pill causes a slight increase in our testosterone, yeah, then if we do a blood test, the levels will still come back normal, but it's a very minimal increase. And what this does is this causes the sebaceous glands in the skin that secrete oil to start hypersecreting. And when these start hypersecreting, then we get excessive oil. Now we have excessive oil. The skin is shedding itself as it does every 28 days. Yeah, and then we have dirt, dust, and sweat from the atmosphere. Now this clogs the pores. So we have a cake, a microscopic cake blocking our pores of sweat, dirt, oil, and dead skin. And once this clogs the pores, then the skin can't breathe. Now, the sebaceous glands are still secreting more oil.
Yeah.
So, what happens is the oil gets stuck underneath the skin and it becomes a nice, juicy little cyst, which the bacteria love. So, then the bacteria come in and they also attack the acne cyst. And that is actually what we describe as the genesis of acne or the pathophysiology of acne.
How do I know if I use this contraceptive, it will affect my skin in a negative way? Is there
Now,
something to?
a lot of times it may be hard to tell because we're all human beings and we're all very different.
Yeah.
One man's meat is another man's poison.
Yeah.
What may work for you may not work for me, for example. But in general, if you're going to take a contraceptive, then you need to discuss it with your gynecologist. However, I would recommend Diane or Yasmin, which are also used for the treatment of acne at the same time.
All right. We will now take a short commercial break, but when we come back, we'll be talking about treatment and prevention of some of the skin diseases. Do not go so far.